Good morning, good afternoon, good evening, good day to all of you. And this is our session working directly with boys and men to end GBV through gender transformative approaches, experiences from Burundi, Indonesia, and Ethiopia. I want to give you a warm welcome on behalf of the Men Engaged Global Secretariat. My name is Osvaldo, and we are very, very thankful that we can do this session in collaboration with these great organizations. Please follow this event in our hashtag, in the Ubuntu Symposium hashtag, and in Spanish is the Symposio Ubuntu as well. Without further ado, I'm going to pass this to Anna, who is the moderator for this session. Thank you so much.
Thank you, Osvaldo. Good morning, good afternoon, good evening to everyone on the line, joining us from wherever you may find yourself. My name is Ana Aguilera, and I'm the Deputy Director for Adolescent and Youth Sexual and Reproductive Health and Rights at Engender Health. And I'm so pleased that I get the great privilege of moderating this session today, working directly with boys and men to end GBV through gender transformative approaches. I know you're all very excited, and that's why you joined us today. So to start off, I will just pass off to three of our wonderful panelists and speakers for today for them to introduce themselves, and we'll start as you see on the order of the screen. So Vandana, please go ahead and introduce yourself, and then Ingrid, and then Lucy.
Great. Well, hello, everybody. My name is Vandana Sharma. I'm a researcher based at the Harvard T.H. Chan School of Public Health and the Harvard Humanitarian Initiative, and I work on developing and testing prevention programs addressing intimate partner violence. So I'm really pleased to be here today and looking forward to today's session.
Great. Ingrid, would you like to go ahead?
Okay. Hi, everyone, and good day, good evening from Indonesia. My name is Ingrid Irawati Atmusukarto, and I'm an independent consultant at this moment. The work that I am presenting today is from my previous engagement with Prevention Plus, where I was the SGBV program coordinator managing the Prevention Plus program in Indonesia. Thank you.
Thank you, Ingrid. And over to you, Lucy, to introduce yourself.
Bon après-midi tout le monde. À partir du Burundi, je m'appelle Lucie Nyamarushwa. Je travaille pour l'organisation Gender Health comme spécialiste en genre et violence basée sur le genre. J'ai une expérience depuis 15 ans dans le domaine. Pour le moment, je travaille dans un projet qui est mis en œuvre conjointement entre Gender Health et une organisation locale et qui met en œuvre une approche d'intégration genre et violence basée sur le genre dans des programmes de VIH. Je suis en même temps représentante du pays au Burundi ou de country manager pour Gender Health au Burundi. Merci.
Thank you so much, Lucy. So to start off the session today in the format, we will have three very short presentations from our speakers and then move into an interactive panel and question and answer time. So we will have ample time to address your questions, so please feel free to type them in the chat box as we go. And to start us off, we will pass it over to Dr. Vandana. So Dr. Vandana, over to you, and I'm sharing your screen.
Wonderful. Thank you so much for the opportunity to share lessons and findings from Unite for a Better Life, a community-based program to prevent and reduce intimate partner violence and HIV transmission, which our team first developed and tested in rural Ethiopian contexts. Now, this project was implemented in the Southern Nations, Nationalities, and Peoples region in Ethiopia between 2012 and 2018, with a number of key partners, including the Abdul Latif Jamil Poverty Action Lab, or JPAL, Addis Ababa University, Engender Health, and the Ethiopian Public Health Association, with support from other stakeholders, including the Ethiopian Ministry of Health, and other stakeholders in the area. Next slide, please. So let's begin with a quick overview of the Unite for a Better Life program itself, and then we'll move into some of the research findings from the randomized control trial that we conducted. Next slide, please. So Unite for a Better Life is a gender transformative program that aims to prevent intimate partner violence and HIV transmission through group-based participatory sessions that focus on building skills. Now, the UBL sessions are delivered by trained same-sex facilitators within the context of a cultural or community practice in order to increase the cultural relevance and potential effectiveness of the program. So the program was first developed for rural Ethiopian communities, where the sessions are delivered within the context of the traditional Ethiopian coffee ceremony. The program includes 14 different sessions. Each are about 2 to 3 hours long, and they include topics such as gender roles, healthy sexuality, HIV and condom use, boundaries and sexual consent, power and control in relationships, joint decision-making and task sharing, communication, emotional regulation, conflict resolution, and as well supporting survivors. Typically, the sessions are delivered to groups of about 20 participants, and each group sort of goes through the program together, the 14 sessions, and the sessions are delivered twice a week, and the groups comprise either groups of women, groups of men, or groups of couples. Next slide, please. So Unite for a Better Life, or UBL, is designed to address the interaction of individual, relationship, community, as well as societal factors that influence IPV and HIV transmission in this context. So the program aims to improve knowledge, attitudes, and skills related to IPV and HIV, as well as improves couples' healthy communication, increase task sharing and joint decision-making, and reduce HIV risk behaviors and substance use, and thus ultimately reducing IPV and HIV transmission. Next slide, please. And so I mentioned that the sessions are led by same-sex facilitators. Now, their role is really to draw out knowledge and experiences from the participants and to foster discussion to shape attitudes, build skills, and increase motivation to change behaviors. In many settings, gender roles are defined from a very early age. And in rural Ethiopia, while men and women typically do participate in the traditional coffee ceremony, usually it's the women who prepare the coffee and pour it and serve it to the participants. So implementing the program within the context of the coffee ceremony offered an interesting opportunity to model and promote more equitable gender norms. So in the men's groups, male facilitators would actually model the preparation of the coffee for those first 2 sessions out of the 14. And then following that, in subsequent sessions, the male participants were expected to take turns to prepare the coffee in the different sessions. Similarly, in the couples groups, the 2 facilitators, so there was always a male and a female facilitator in the couples groups, they also modeled together the preparation jointly of preparing the coffee during the first 2 sessions. And then in subsequent sessions, different couples would take on that role together in preparing and serving the coffee. Next slide, please. And I'll just really quickly mention that we began this program in 2012 in rural Ethiopia, as I mentioned, and there we have tested the program in a large cluster randomized control trial, which included over 6,700 households across 4 districts. I'll share some of those findings in just a minute. But I just wanted to also mention that we had secured some additional funding to adapt the program for a humanitarian context, in particular Somali refugee camps in Daloado, Ethiopia. And there we had conducted some formative research to understand the drivers of IPV and HIV risk in that particular setting and how displacement has altered the risks. And then the program is adapted for that context. And then we also did a second adaptation, where the content was adapted for a podcast-based intervention. And there, the idea was to expand it to harder to reach populations where in-person group-based sessions may not be possible. And this approach is particularly relevant in the context of COVID as well, as we have a lot of restrictions on in-person gatherings. And so with this version of the program, the sessions are delivered via audio episodes that contain dramas, interviews, debates, and they can either be broadcast at listening centers, which are safe spaces within the community, or they could be listened to on individuals' own mobile devices in their own home. Next slide, please. So now I'll share some findings from the evaluation of Unite for a Better Life that took place between 2014 and 2018. Next slide, please. So in the rural Ethiopian communities, we conducted a 4-arm cluster randomized control trial to evaluate the impact and relative effectiveness of delivering Unite for a Better Life to women, to men, or to couples. And we compared that to a control group. Now, in the control group, participants did receive a very short informational session on violence reduction, but they did not engage in any of the group-based sessions. Each of the interventions was implemented in 16 villages, and those villages had been randomly assigned to one of the interventions or to the control group. And in total, about 106 people per village were randomly selected for participation in the trial. We collected end-line data 2 years after the intervention delivery in order to assess the impact of the program. And we had follow-up rates of about 88% at end-line. So next slide, please. So the main findings of the trial were published last year in PLOS Medicine. So the citation is there on the bottom of the slide for those of you who are interested to learn more. Since then, we've had several other papers that have come out as well, including sort of some of the broader community level impacts and the cost effectiveness of the program. And we can certainly share those with you. But to highlight the main findings of the trial, we found that in the men's arm in particular, where groups of men participated together in the program, we saw significant reductions in male perpetration of past year sexual intimate partner violence and past year physical and or sexual IPV. Now, what's interesting is that we also interviewed the partners of these participants. So for all of these men who participated in the program, we also collected data from their wives or partners and found that women's experience of past year physical and or sexual IPV was also significantly reduced in these villages where the men participated in the program. And then among the men who were highly exposed to the program, that is, they completed 12 or more of the 14 sessions, we also saw significant reductions in physical IPV. Now, all 3 versions of the program, the men's version, the women's version, and the couples version, did also have positive and significant impacts on a range of HIV-related outcomes among men and women, such as condom use at last intercourse, discussing sex and HIV risk with their partner. And there was also evidence of increased male involvement in childcare and in household chores, and also significant improvements in joint decision-making. Next slide, please. We also gathered numerous stories about how the program impacted lives, not only of the participants of the program, but actually also of the facilitators and the UBL program staff as well. For example, one of the UBL facilitators described how the program transformed his own life. He says, "This program made significant changes in my personal life. There were many traditional gender norms that I considered impossible to change, but this program has enabled me to change this thinking." Next slide, please. And then just to highlight a couple of key lessons from this work that are relevant when thinking of designing and implementing IPV prevention programming. And some of these lessons are applicable as well in the context of COVID, but of course need to be adapted or modified given the current realities on the ground. But I just wanted to stress how important it is to prioritize community engagement and participation in all aspects of IPV programming, from development to adaptation to implementation to monitoring and evaluation. In our project, a community advisory board was set up to provide ongoing feedback, and we also had regular consultations with women throughout to make sure that the content and the approach was really well tailored to their needs. Some other lessons include the importance of formative research to understand the specific determinants of IPV in the setting of interest, and to define and prioritize community interests and needs. We found that pilot testing and refinement of the program based on learning and feedback from the community was also extremely important and helpful. And then the other thing I wanted to mention is, in a program such as this, how important the facilitators are to a program. They're really the agents of change, and they sit at the heart of the program and the approach. So ensuring that these facilitators are well equipped to take on the role was really important. So they took part in a multi-stage experience-based training program, and that was really critical for the success of the program. So the facilitators first participated in the program as participants. Then following that, they were able to undergo specialized facilitator training. And then with respect to program delivery, there are a couple of key lessons there. First, connecting the intervention to the cultural ceremony, the coffee ceremony in this case, was a very effective way to link the intervention to participants' daily lives. Second, various elements of the program delivery, such as the timing, frequency, and location of sessions, were best determined through the formative research, community consultations, and piloting. And then risk mitigation and ethical considerations need to be integrated at all levels of the program to ensure that it doesn't cause any additional harm, and that when there are disclosures of violence, that those can be addressed. And then finally, as you've seen with our trial findings, engaging men throughout was really critical for the impact of the program. Last slide, please. And then just to end, I wanted to highlight how important evidence-based programming is in order to achieve sustainable and meaningful change, and that historically IPV and GBV prevention programming and research has been underfunded. And so there really is a need to prioritize funding in this area. And we've been doing a little bit of thinking around sort of how to continue IPV prevention programming during a pandemic, especially when there are lots of restrictions in place. So I've just highlighted a couple of key lessons there about sort of drawing on previous evidence, even evidence from pre-pandemic is relevant now, and can help inform some creative adaptations that could be delivered within the context of the current situation. But keeping in mind that changing modalities, for example, to remote delivery could lead to additional types of violence or additional forms of harm. So we just need to make sure that we're constantly monitoring unintended consequences and potential risks and addressing those as they come up. And I'm happy, to talk about this more in our Q&A, because I think it's a really interesting area. And I'm sure a lot of the participants of the session have also been grappling with some of these issues. So I'll stop there, and thank you so much for the opportunity to share. Thank you.
Thank you, Dr. Vandana. That was a lot to pack in 11 minutes. So please feel free to put your questions in the chat. We promise we will get to them in the interactive Q&A session. And while you do that, we will pass the microphone over to Ingrid. So Ingrid, I am sharing your slides and feel free to get started when you're ready.
So hi, and thank you. It is a pleasure to be here to this session. It is such a contemporary topic, and I'm here to present the work supported by Rutgers Indonesia and Rutgers International. But also, I'm very happy to see Asia being present, because we say, or as they say nowadays, representation matters. So next slide, please. Briefly, I would like to put things in context. We can see here a little bit small map of Asia. So Asia is in Southeast Asia. And most of those who have been to Indonesia, usually they know Bali, the island of gods, especially after the film Eat, Pray, Love came out. So I've noted Indonesia is vast. Geographically, population-wise, we are among the top 5 most populated nation in the world, and culturally very plural. But also, it is worth noting that in the past 12 years, the annual report of the National Commission on Violence Against Women recorded that a more than 700% or nearly 8-fold increase in cases of sexual violence occurred since 2007. And throughout 2019, the Commission reported more than 400,000 cases of violence against women, of which 6% higher from the previous year. And we all know, most of us know, that every case reported, many more remain hidden, and not only in Indonesia, but also globally. And the latest numbers, especially during the COVID pandemic, also saw increases in particularly online-based violence. Next slide, please. So the work with Rutgers, Indonesia and International is from the Prevention Plus project or program. So Prevention Plus is a multi-country program that envisions a world where healthy, respectful, and equal relationships are the norm. To contribute into making this a reality, the program addresses the root causes of gender-based violence, social, economic, religious, and cultural contexts that shape attitude and behavior that lead to violence. The program is supported by Rutgers International in the Netherlands, and it is managed by Rutgers Indonesia in Jakarta. And this is a 5-year program, and it ended last year. Next slide. Just as we saw with UBL, we also are using the social ecological framework. So Prevention Plus complements the work and advocacy of feminist groups and social justice movements to end gender-based violence. And this 5-year program fosters positive interactions and gender-equitable relationships to address the root causes of GBV by taking a multi-level approach, designing intervention at 4 levels of society: individual, community, institutional, and government, to transform the intersecting social and structural factors that allow GBV to persist, and to actively engage young and adult men as part of the solution. So that is engaging them as partners, advocates for change, alongside young and adult women to challenge and transform harmful gender norms and practices. Next slide, please. Next slide. Thank you. Thank you, Anna. So we are working mostly in 2 islands, on the islands of Sumatra and Java. And we were working with 5 partners, local NGOs. They had almost all of them had long records of handling GBV cases, including providing legal services, women and children's rights. Next slide, please. And some of the activities that Rutgers, through the project Prevention Plus, was supporting, among others, and it is quite similar to the coffee ceremony discussion. So regular community discussion for 4 groups: adult women, adult men, teenage girls, and teenage boys. And it was it was meant to be same-sex facilitators, although sometimes They were different sex, but it was basically a same sex. So yeah, women facilitator for women cases, and male facilitators for male classes, not cases. Using modules with the themes of gender equality and the involvement of men and boys. We also supported sexual and gender-based violence counseling, including psychosocial and providing legal assistance for survivors. We supported also campaigns through various media. And for example, we also supported a short film from Yogyakarta, our partner there, that produced a film entitled Asa, which means hope, and was accepted as a finalist for a festival in Asia. The film depicted violence against women. We also support the campaign with social media content, including the use of comics. In terms of advocacy, from the village level to the national level, including production of several task forces for handling violence against women and violence against children in Lampung, and as well as advocacy for budgeting in Yogyakarta and national level advocacy for law enforcers, police, and prosecutors. Next, please. And in terms of numbers, of which details are depicted here, in the short 5 years of implementation, this much that have been achieved, as we can see, from educating people to producing material and to developing policies at national and subnational level. So this is the overall work of the Prevention Plus project in Indonesia. But we are going to focus today, because this session accepted the abstract for this topic. Next, please. For the work in Yabima in Lampung, with Yabima, the NGO Yabima in Lampung. So I would like to take our focus here on the island of Sumatra. So it is that their work that we are going to highlight today. Next, please. And I think we're going to look at one of their work, which is a clip of their dance. Please, Anna, if you can play it, thank you.
sebenarnya manusia itu? Siapa laki-laki dan siapa perempuan? Apa hubungannya? Apa dunia yang diimpikannya? Kau pilihkan aku warna hitam untuk laki-laki dan merah muda untuk perempuan.
Lantas, apakah warna yang membedakan jenismu? Bagaimana dengan warna kulit?
Hijau biru kornea mata, warna rambut dan lainnya.
Jangan ada angkara di antara prasangka yang menyiksa demi cinta kita.
Ini bukan tuntutan, bukan pula pembuktian. Kami hanya menciptakan clue.
Okay, Anna, thank you. So this is a 15 minutes of a dance, and I was going to, this is just a clip in the middle, and I will let you know more about this dance and what is actually happening there shortly after this. So first, let me take you to the institution or the organization that facilitated the creation of this dance. Next, yeah, Yabima, thank you. So Yabima, which is a local NGO in Lampung on the Sumatra Island, it evolved from a community work in the of the South Sumatra Christian Church. So this is a community, it's most of a Christian community, which is quite rare because Indonesia is the most Muslim populous country in the world. So this is quite a unique community. And we have many communities like this, as I said in the beginning, that Indonesia is quite plural. So the main work of Yabima is in community organizing, particularly for peace building. And the work that they do is much affected by the social context in the area. And it's colored by much agricultural-based conflict. 2 years ago, there was a conflict that led to armed conflict in the area and had fatal impact. But also they're also working with organizing farmers in non-conflict area in the region. So Yabima Indonesia is supporting approximately 60 farmer groups for mass organization and 8 cooperatives. And most of their assistance provided is to poor farmers in the area that have minimal access to clean water, sanitation, and health. And to this date, they are also facilitating and organizing 167 livestock health volunteers and 20 organic farmer cadres. So Yabima joined Prevention Plus only in the last 2 years of the 5-year implementation period, especially by focusing their work on serial community discussions, GTA trainings, so Gender Transformative Approach trainings, and various campaigns. Next. So what we just saw was a very short clip of it's a 15 minutes dance, and the dance was just that we enjoyed was performed by the students from the Christian high school in Metro Lampung, and these are boys and girls, most of them, and it is based on one of the dancers' experience. So one of the dancers, a boy, he was impressed by the Korean female group Blackpink, and which inspired him to pursue dancing. And as he started dancing, he also started to get bullied by his male colleagues. And so this dance was inspired by his reflection on experiencing bullying during a period where he was also participating in serial community discussions for boys. And much of the bullying arose here from gender norms in his surrounding that affected the way boys and girls thought and acted. And so dancing here proved transformative for him as he gained confidence. And not only did he show that he was able to dance well, but also that dancing was not a girl thing. and then his fear stopped. His friends stopped bullying him after that. So dancing was a great way to express their joy and anxiety that they were going through. But more of that, dancing was also a way to send a message that can be seen, a message that can be heard, but also a message that can be experienced by the dancers and by the audience. Next, please. So the dance that we just saw is entitled Penindas, from the Javanese oppressor. So it means oppressor in the Javanese dialect. It starts actually at the beginning, which we didn't see. It starts with aggressive movements by the boys. And then we just saw how the girls came in, which is the clip that we just saw. And then the girls, they started questioning the gender roles, discrimination, social norms. So at some point, the girls are challenging the boys by highlighting some harmful norms. And they were saying, you choose the color black for boys and pink for girls. So what does the choice of those colors mean? And then they continue on talking about, what about women leadership? Can they be leaders? But also, what about sharing household work, like boys caring for the babies? And as they danced on, the girls stated, more at the end of the dance, treat us as humans. Manusia menjaga keseimbangan, bukan menciptakan ketimpangan. Or in English, humans maintain balance, not create inequality. So the movements are inspired by here, from the sound and the movements and the costume are inspired by Javanese traditional sounds. Next, please. So I hope you enjoyed this dance, but also the process towards this was not easy. There have been challenges, and it was interesting because the challenge in the creation of this dance, it arose from the values that those young people tried actually to challenge. The teacher herself was questioning the presence of boys in dancing at the beginning. And so it took some time, it took some efforts, some educating and convincing by Yabima, the NGO. So she was asking, dancing for boys? But girls, it was okay, it was acceptable for girls to dance. So it was interesting to see how these cultural and social forces even permeated into the arts, into dancing. So it was also a reflective moment, not only for Yabima, but also for Rutgers Indonesia, as we're hearing these challenges. Next, please.
Ingrid, sorry to interrupt, but we have just one more minute.
Okay, no problem. This is the last one. So what we have learned, this approach of giving space for young people to express themselves through the arts provides valuable but also educative. So education is vital to ending this vicious circle of violence. And the process of dancing became a process spectrum that utilizes communication skills supported by critical and creative thinking to prevent, to manage, and end conflict in a peaceful manner. And this is significant where young people are most vulnerable in conflict situations, especially vulnerable to trauma. And in this case, the process of dancing, coming up with the choreography, the meaning, and the performing itself became a transformative experience in terms of gender justice, life skills, and emotional management. The process showed the possibility to create connection between movement and social movements. And what we think from here is that it is so best to start early. But also, it was also not worth noting that this was not a program activity, neither from Rutgers, and it actually came from the school's own initiative, and it was facilitated by Yabima. And so we from Prevention Plus with Rutgers Indonesia, we learned that the modules introduced by Rutgers inspired the community, and they paid it forward. They did their homework. They educated themselves on GBV, learning from the Prevention Plus material and what they have learned from the discussions. And so this is important. that development agencies such as RUGAS and all others, the work should be able to inspire communities beyond the plans and paths and roadmaps that we create, that we have developed. But to be able to create some sense through this process, we create some sense of sustainability. And since most of the work that we do as the development agencies are limited in time and resources. Next. So this is a picture of all those dancers with the teacher. Next. Thank you. Next. And this is the context. So this is me. And here I'll put the context for RUGAS Indonesia and also YABIMA, the local NGO. And thank you.
Thank you so much, Ingrid. Thank you. Please put your questions in the chat box. We will get to them right after the next presentation. So while we do that, I'm going to say, Lucy, if you can unmute yourself, and I will share your presentation. Okay, over to you, Lucy.
Merci beaucoup, Anna. Encore une fois, bon après-midi à tous les auditeurs. La présentation que je vais faire porte sur l'approche les hommes comme partenaires dans la lutte contre les violences sexuelles basées sur le genre. Sa mise en œuvre et les leçons qui ont été apprises dans le contexte du projet Bravi, les Burundais répondant à la violence et les inégalités mises en œuvre au Burundi. Next slide. Pour commencer, je vais vous présenter l'organisation Gender Health. C'est une organisation qui met en œuvre un programme spécialisé surtout techniquement dans la mise en œuvre des programmes basés sur les droits de l'homme en matière de la santé sexuelle et reproductive. Et travaille spécialement dans 12 pays sur le continent asiatique et en Afrique. L'organisation Gender Health met également en œuvre des programmes avec une perspective de genre, avec des organisations de la société civile. Elle intègre la dimension genre, jeunesse et inclusion sociale dans tout ce qu'elle met en œuvre. Maintenant, un bref aperçu sur le contexte burundais des violences sexuelles basées sur le genre. Tout d'abord, 23% de femmes ont rapporté avoir expérimenté, connu une violence sexuelle et 13% dans l'espace d'une année. Le taux des hommes est de 6%, varie de 6% à 2% respectivement. Et puis, parmi les hommes et les femmes, 62% de femmes et 30% d'hommes croient que battre une femme peut être justifié dans certaines circonstances. Dans la mise en œuvre, on a constaté que, selon le contexte toujours, les violences domestiques varient d'une province à l'autre. Elles affectent particulièrement les femmes à plus de 31% dans la province de Bujumbura, à 50% dans la province d'Ongozi, 73% dans la province de Kirundo, et 6% d'hommes dans la province de Karuzi, 45% dans la province de Kirundo et 50% dans la province d'Ongozi. Les violences basées sur le genre ont une incidence sur le VIH. C'est pour cela que les femmes restent plus touchées que les hommes, avec un taux de 1,2% et 6,6% d'hommes qui vivent avec le VIH. Et cela a aussi une incidence, bien sûr, sur la mortalité. C'est-à-dire que 1900 décès au Burundi annuels sont attribués au VIH. Et comme autre conséquence triste, c'est que le nombre d'orphelins reste élevé. Il est estimé à 73 000, les orphelins du VIH-Sida. Alors, je vais vous faire une présentation sommaire du projet Bravi et de l'approche MAP que le projet a mis en œuvre au Burundi. Tout d'abord, Bravi, en toutes lettres, c'est les Burundais répondant à la violence et aux inégalités. C'est un projet de 5 ans qui a été mis en œuvre de 2014 à 2019, donc un projet de 5 ans qui était financé par USAID et donc mis en œuvre par Gender Health. Ce programme cherchait à améliorer la prévention et la réponse aux violences sexuelles basées sur le genre, en intégrant aussi la dimension planning familial dans les services de violences sexuelles et basées sur le genre. Cette approche homme comme partenaire dans les violences sexuelles basées sur le genre, historiquement, a été développée par Gender Health en 1996, et puis elle a été mise en œuvre dans plus de 30 pays dans le monde entier. Et même au Burundi, je vous dirais que au cours du projet, le ministère des Droits de l'Homme était intéressé par l'approche et elle était parmi les approches qui étaient testées pour être adoptées nationalement. Le processus est en cours. Cette approche engage les hommes à jouer des rôles constructifs et à promouvoir l'égalité genre et aussi l'amélioration de la santé et dans leur famille, mais aussi dans leur communauté. Parce que si les hommes s'impliquent dans la lutte contre les violences basées sur le genre, c'est tout ça les bienfaits au niveau familial et au niveau communautaire. Alors, les activités clés qui ont été mises en œuvre par le projet Bravi ont été essentiellement la formation des champions, donc des hommes champions d'un âge compris entre 25 et 39 ans. Donc, c'est la tranche encore vigoureuse, la plus dynamique, mais aussi qui est potentiellement exposée à perpétrer les violences basées sur le genre. Le projet a également formé 12 facilitateurs locaux sur l'approche MAP pour constituer donc une pépinière de formateurs sur l'approche intéressante. Et ces facilitateurs ont à leur tour formé 425 hommes. Et les 425 hommes, pardon, et les 425 hommes ont pu sensibiliser un nombre de 3024 hommes additionnels sur les violences sexuelles basées sur le genre. Pendant les formations, les sujets, les thèmes clés discutés portaient essentiellement sur les normes genre positives, la promotion de la masculinité positive, mais aussi la prévention des violences basées sur le genre dans la vie des hommes qui étaient d'abord formés et puis dans les communautés entières. Alors, quels sont les résultats très majeurs qui ont été enregistrés par la mise en œuvre de l'approche homme comme partenaire? D'abord, on a constaté une augmentation de 35,2% d'hommes qui croient que les hommes et les femmes ont des droits égaux et doivent être traités équitablement. Et en plus, comme autre résultat, des formations et des sensibilisations, 554 hommes ont volontairement adhéré au test VIH, c'est-à-dire plus de 30% par rapport à ce que aux cibles du projet. parce que le projet tablait initialement sur 425 hommes, mais finalement, il y a eu plus d'hommes qui se portaient volontaires pour faire le test VIH. Alors, nous avons un témoignage d'un participant sur l'impact de cette approche MAP sur lui-même. Et cet homme dit que au début, avant la formation, il battait souvent sa femme. Et sa femme faisait toujours la navette entre la maison et entre la maison conjugale et la résidence de ses parents. Mais avec les formations, cet homme j'ai finalement compris que battre ma femme, rien ne peut justifier cet acte. C'est un changement par rapport à avant la formation. Autre chose, quand je rentrais à la maison, pour avoir les rapports conjugaux, je sautais sur ma femme. Mais avec les formations, j'ai compris que il faut toujours demander le consentement de la femme chaque fois qu'on veut faire l'acte conjugal. Sinon, si on le fait sans consentement, ça s'appelle viol. Bon, évidemment, la mise en œuvre de l'approche homme comme partenaire dans la lutte contre les violences sexuelles basées sur le genre a connu des défis, mais aussi il y a des leçons apprises. Parmi les défis rencontrés, les femmes embrigadées par la culture n'ont pas toutes accueilli les changements positifs qu'ils ont constatés chez leurs époux. Donc, c'est-à-dire que pour un certain nombre de femmes, le changement subi chez leurs hommes était perçu comme une source de critique à leur égard. Souvent, on dit que la femme a ensorcelé l'homme pour adopter subitement un nouveau comportement. Par exemple, le fait de porter un bébé, de laver un bébé. C'est pour cela que il y a un certain nombre de femmes qui avaient plutôt peur de ces changements qui venaient plutôt pour leur propre intérêt. L'autre défi, c'est que pour cette approche, l'évaluation a surtout recueilli la perspective des hommes. Donc, les hommes qui ont participé à la mise en œuvre du projet, c'est une limite dans le sens où on n'avait pas la perspective d'autres membres de la famille comme la femme et les enfants pour pouvoir attester effectivement les changements qui étaient déclarés par les hommes ayant participé au programme. Un autre défi, c'est que les résultats ont tout de même relevé qu'un changement plus ou moins mineur dans certaines attitudes, ce qui est normal. Donc, ceci parce que le changement de culture, c'est tout un processus. Donc, c'est-à-dire que l'approche était vraiment comme un jalon, sinon le changement est un processus qui prend du temps. On a salué les premiers résultats, mais le processus est fastidieux. Comme leçon apprise, la mise en œuvre de l'approche homme comme partenaire dans les violences basées sur le genre aurait plus d'effet si elle est couplée, ou a plus d'effet si elle est couplée avec d'autres approches comme le genre transformatif ou le genre synchronisé. C'est une approche qui s'adresse en même temps aux hommes et aux femmes, qui les prend ensemble parce que le changement doit impliquer à la fois les hommes et les femmes. Et puis, les engager tous simultanément dans un changement. C'est plus harmonieux. Et pour preuve, les hommes qui ont été formés avec l'approche MAP l'avaient aussi dit que ça aurait été bénéfique que les femmes aussi soient partie prenante à la formation pour que les changements, pour que les informations soient partagées et que les changements vécus par les hommes soient positivement salués par les femmes et qu'ils puissent cheminer ensemble dans le processus de transformation parce qu'il disait, si l'homme et la femme se transformaient ensemble, ça a un effet multiplicateur sur les enfants aussi. Alors, dans le futur, alors, il faut aussi tenir en compte et impliquer les femmes dans les formations genre transformatives, mais aussi dans le processus de collecte de données. Il faut aussi recueillir l'avis des femmes et des autres membres de la famille pour attester les changements qui ont été effectivement déclarés par les hommes formés. L'autre leçon apprise, c'est que, j'avais déjà anticipé, la transformation des normes genre qui s'adresse aux notions de masculinité négative, c'est un processus fastidieux et qui prend du temps, où il faut y travailler continuellement pour avoir des résultats substantiels et un impact substantiel significatif aussi. Donc, voilà ce que j'avais à vous partager sur l'approche MAP ou l'approche homme comme partenaire dans la lutte contre les violences basées sur le genre mise en œuvre au Burundi par Gender Health. Je vous remercie pour votre aimable attention.
Thank you very much, Lucy. And so we are now entering the panel and question and answer portion of this session. We've received so many wonderful questions, and we'll do our best to get through and get your questions asked for the presenters. So to start us off, what I thought we would do is ask a few pointed questions to the presenters that the audience has asked. And then we will have maybe reflection questions for all of the presenters to comment on. So we'll start with Dr. Vandana. Dr. Vandana, we had quite a few questions come through, and so we'll just touch on maybe two. Someone from the audience asked us, what did you find most effective in reducing IPV? Was it the men's group or the couples groups, and why? So maybe you can elaborate more on the results of the RCT. And then also someone asked us, were there any other cultural touchstones identified where the involvement of both men and women in this RCT were both equally valued? So over to you, Dr. Vandana.
Wonderful. Thanks so much for those questions. In terms of the first one, so in our trial, what was interesting is that the reductions in intimate partner violence were only found in the trial arm where men participated in the sessions together. So in the villages where couples participated, we did not see reductions in intimate partner violence. And so that's really interesting. And you know, we're trying to understand that better. We're working on some of the qualitative data from the trial as well to kind of better understand the mechanisms through which the program may have worked and why we see these differences. One thing that we have noted is that some of the other couples interventions in other contexts that have found to be effective, such as Banda Bareho in Rwanda, and a couple of others, in those couples interventions, there is usually included separate time for men to engage in same-sex groups as well as with their partner. And so Banda Bareho in particular, there's 15 sessions in total, and in 8 of the sessions, the couples participate together, but in the remaining 7, the men participate in same-sex groups with other men. So in our UBL program, in the couples intervention, there was room for these same-sex discussions with small groups of men and small groups of women within the sessions. They would separate out for some of the sensitive discussions, but it wasn't at that level of, say, Banda Bareho. So one of the things we've been wondering in our team is sort of how much of the sort of same-sex dialogue is even needed within a couple's intervention to make sure that it's effective. So those were some of the thoughts we had, but we're trying to better understand some of those mechanisms of action. On the second question about cultural touchstones, I think the main one that came out really was the coffee ceremony. I mean, we were looking for a way to connect the program to the lives of people, and the coffee ceremony was identified by all of our colleagues in Ethiopia and our local partners as being the one that would be most relevant to people's lives. When we worked to adapt the program for a different context, the Somali refugee context, part of our formative research was to understand similar types of cultural ceremonies or practices that could serve a similar purpose in terms of the intervention. And so with the Somali context, we changed the coffee ceremony to tea talks, because tea was a way that people gather together to dialogue and discuss, and an important part of that context. And I think when we work to adapt this to other settings, we will similarly be working with local partners to identify a platform for the intervention delivery that makes sense in that particular setting.
Thank you so much, Dr. Vandana. And we'll pass it over to Ingrid. Ingrid, some great questions coming from the audience. And so I'll just quickly summarize maybe two. One is more about bringing your perspective of using dance and art to engage men and boys in violence prevention. From your experience, what recommendations or lessons learned can you share with us all today for those of us who are interested in and maybe want to do this more? So that's one. And then the second question is, maybe if you can talk a little bit, someone asked about decision-making power and decision-making roles of women before the implementation of this project and then afterwards. So if you can touch a bit on that, that would be great.
So thank you for these questions. And I will start with the first one on how to engage boys with the arts and dancing here. So just imagine boys and dancing, and how just the thought of that, they will start by rolling their eyes first. But so for the project, it is the serial community discussion where the boy that was bullied at the beginning was involved. It equipped him with enough informative information and ammunition to respond to the issues related to toxic masculinity. So he was later on able to reiterate the concept in the language that his peers will understand. And so what we recommend is to start off by creating a safe space. So how did the boys like to talk? What is the space they like? So creating a safe space for the boys to talk, especially for the boys here, where they can talk about their anxiety and their fears, because we all know that usually it stems from that. And so we tackle that first. So identify what is the rooting issues that is pushing them to act violently, bullying, and so forth. So to tackle that first. And then this is where the community discussions comes in terms of providing education. So the serial, we call those serial community discussions because they are serial. So they have to be participated. There are 6 to 7 sessions, and we begin with question at the beginning, and then the serial discussion ends with also question at the end. So it's a long process, and for each session, I'm sure there are internal conflict, and reflection, and so forth. And so the boy was able to, in a safe space, to talk about that. And so once they saw that the boy was able to perform, and the admiration that came after that, then the boy, earned the respect of his peers after that. And so a space like that could be facilitated by an adult, but it also can be facilitated by the educated or participating boy. If the person is confident enough and have the adult observing from afar. So that will be one way doing that. But also for us project managers, that's one of the lessons we learn, is that we have to broaden our horizon beyond the project. So we are here. So what is the art? What is the social context? What is social scene in the area? For example, in Lampung, that community is very specific. It's very different from the entire Lampung. From the entire province, because those are Javanese descendants that are migrants, and that's why they have different religion. It's very Christian. While Lampung generally is mostly Muslim, but also that the NGO works with all religions. But also that's why it's important to understand the context and see what is acceptable there, and just manage the language. And at the end of that, what it's learned is that the arts, and here dancing, it can be liberating. So not only for the girls, but also for the boys, it became liberating for them. So that's for the first question. And for the next question, in terms of measuring decision making of the women after the approach of the project. So prevention plus one of the activities, especially the serial community discussion, it is a serial of 6 to 7 sessions. At the beginning, we have a questionnaire where they have to fill it up. So that's more understanding, knowledge based, and then at the end with also some measurement of attitude and so forth. And at the end of the 6 or 7, we also have the same survey. So we have quantitative measurement, but also continually we collect stories of change, and that's also an opportunity for example, the project manager to interview, to connect with the groundwork. So here for the NGOs and with the beneficiaries. So this is where we saw changes. We collected stories of changes. So for example, that's how we had the stories of how at the beginning, they will say how at the beginning of the discussion, the man or the husbands refuse to do household work, but then as they proceed by the mid sessions, like the 3rd or 4th, they started to have conflict, and then at the end, the husband started to take more household work, and the wife was more involved in decision making in the family, and so that was more of a qualitative approach, and that's how we took some, qualitative measurement in terms of seeing decision making dynamics in the household from our partners. Now, thank you. So I hope this answered. If not, let me know.
Great, thank you, Ingrid. And if you have more questions specifically on what Ingrid has just said, please type those in the chat box. Okay, over to Lucy. We have a few questions for you as well, and then we'll do one overall question for all the panelists, which we've received some for those. So Lucy, the Men as Partners approach uses the term male champions. And someone from the audience is asking us that, this term has been criticized in some spaces for promoting a patriarchal notion of men as leaders, as the main leaders and the main heroes. So this participant would like to understand, how does the Men as Partners, this idea of having male champions, is the meaning in Burundi different, or how do you grapple with this idea that you're trying to change simultaneously how we view women and girls, while also leveraging the existing power that men have? So maybe tell us more about how the project in Burundi balanced that tension, perhaps. And then if you could also tell us about when your experience, what did you find worked well to encourage the men who participated as the trainers and facilitators to pass on the learnings to other men and boys in their communities? So we'll start with those.
Merci Anna. Pour le Burundi, donc spécialement dans le projet Pravi, ce terme champion a été utilisé peut-être avec une autre signification. Comme on a fait, si vous l'avez senti, une formation presque en boule de neige, on a formé des hommes, un certain nombre au départ, donc on a formé des facilitateurs, et puis les facilitateurs ont formé un autre nombre de 425 hommes. Alors, parmi les 425 hommes, j'ai parlé à la fin du changement qui est progressif. Donc, du coup, c'est-à-dire que les hommes avec lesquels on a travaillé n'avaient pas le même rythme de changement, même le niveau de changement. C'est-à-dire que les hommes qui avaient manifesté beaucoup plus d'avancées dans le changement dans leur vie par rapport à leur statut initial. Parce qu'on avait un statut initial, je dois dire que c'est pas dit dans la présentation, mais les hommes qui avaient ciblé par le projet, il y avait des critères. C'était des hommes qui avaient un certain niveau de revenus et qui, donc, comme les taximens, les taxis-vélos, les miniers, les boutiquiers, et qui étaient, dans le contexte burundais, connus comme des, des acteurs potentiels de violence basée sur le genre, et aussi à considérer leur âge. C'est-à-dire qu'au début, la plupart d'eux avaient vraiment été dans un statut très bas. Alors, progressivement, avec les formations, on a pu repérer, et c'était un processus participatif avec la communauté, les hommes qui avaient manifesté des changements dans leur environnement. Il y a des changements qui étaient déclarés par les hommes, mais comme le processus de ciblage avait été participatif, les membres des groupes qui avaient participé au processus d'identification avaient aussi contribué à attester certains changements positifs chez ces hommes. Donc, ces hommes qui avaient alors manifesté un changement positif ont été identifiés comme des hommes. Et je dois aussi souligner que la plupart de ces hommes étaient des membres d'associations, donc faisaient partie des groupements de par leur profession, des associations de taxi-vélo, de taxi-moto, de petits vendeurs. Donc, ces hommes qui avaient manifesté des changements positifs ont été ciblés comme des hommes qui étaient capables de continuer à relayer les messages dans leurs associations respectives pour continuer à générer des changements, à changer aussi leur père. C'est comme ça que on leur a donné ce nom de champion, les hommes champions. La connotation dans le contexte burundais, c'était plutôt ça. Donc, des hommes qui avaient changé à leur façon de vivre, leurs attitudes quant aux normes et genres par rapport à leur statut initial et qui étaient capables de continuer à changer et à instiguer le même changement chez leurs pairs, surtout dans leurs associations respectives. Donc, voilà. Et on a constaté que ce sont des hommes qui se donnaient de tout cœur. Et c'est comme ça qu'on a pu même enregistrer donc des résultats aussi de par leurs actions, comme la participation au test VIH, par exemple, dans le contexte burundais. Les hommes ne sont pas chauds pour aller se faire tester pour le VIH. Ce sont surtout les femmes. Et le taux de participation des femmes est de loin plus élevé, mais de par ce changement, les hommes changés ont pu encourager, stimuler les autres hommes à constater à faire le test VIH pour aussi contribuer à l'amélioration des indicateurs santé. Et voilà, donc le sens du mot champion, des hommes champions dans le contexte burundais et surtout dans le contexte du projet Bravi. Je vous remercie. Alors, pour l'autre question, ces facilitateurs qui ont été formés et qui devraient continuer à relayer les messages dans leur pair, Anna, il faudra me dire si j'ai bien saisi la question, si je ne déforme pas l'idée. Est-ce qu'on donnait une certaine motivation ou bien? Je dirais pas du tout. Tout ce qu'on faisait, et d'ailleurs, dès le début, on a fait comprendre aux participants que c'était la mise en œuvre de cette approche, c'était pour le bénéfice des participants, de leurs familles et des communautés, et qu'on allait bâtir sur l'existant. Donc, c'est-à-dire, on supposait que ce sont des hommes qui étaient déjà dans leur vie, qui étaient dans leur vie personnelle, dans leur vie professionnelle, dans leur association, et qu'on voulait les aider à améliorer, et qu'il n'y avait pas de dividendes. Donc, c'est pour cela qu'on donnait juste les frais de collation pour les frais de déplacement pour les facilitateurs. Et puis, pour les hommes champions, on ne donnait rien du tout. Parce que pour la durabilité de l'approche, on avait déjà informé ces hommes. Et c'est pour cela qu'on a vraiment ciblé des hommes réellement champions qui ont changé et qui ont manifesté des signes de changement palpables et visibles dans leur vie et qui pouvaient adhérer volontairement à aider, continuer, relayer les bienfaits de la formation dans leur communauté, dans leurs associations d'abord et puis dans leur communauté. Donc, c'est pour cela que l'approche qu'on a utilisée, c'est que on a renforcé ces champions, ces zones champions, dans les capacités de communication. Et puis, on leur a donné des outils de communication, de petits livrets juste avec des messages ramassés mais essentiels qu'ils pouvaient continuer à relayer auprès de leurs pairs. Et on les a encouragés à intégrer cette activité dans leur propre activité. Comme ce sont des hommes qui faisaient partie des associations, c'est-à-dire qu'on les encourageait à relayer ces petits messages dans les petits outils qu'on leur a donnés au cours de leurs rencontres et des réunions ordinaires. Donc, demander chaque fois un espace de 10 ou de 15 minutes, soit au début de leurs réunions ordinaires ou rencontres ordinaires dans le cadre de leurs associations, pour continuer à relayer les messages. Et c'est comme ça qu'ils ont continué à travailler. On n'avait pas besoin de leur faire une motivation. Mais aussi de profiter des réunions publiques organisées par l'administration locale et de demander un espace pour pouvoir relayer les messages clés qu'ils voulaient communiquer aux autres hommes. Et sur ce point-là, comme on travaillait de concert avec l'administration locale, ils étaient aussi embrigadés, ils adhéraient aussi au programme et ils accordent facilement l'espace au cours des rencontres publiques pour inviter ces hommes à parler aux autres hommes et à relayer les messages. Donc, ça se fait vraiment sans frais, sans coût. Pour la durabilité, c'est ça qu'on doit faire. Je vous remercie.
Thank you, Lucy. Merci. And I think that's a great segue, your point about sustainability, to a question. We received two questions that, if with everyone's permission, I'd like to sort of combine as the last full question for all panelists today. And that question is really about scale and scalability and the challenges, maybe its implications. So a few participants have asked us, now that you've seen some success across these wide range of contexts and interventions, how can we use these to scale, to bring them to a larger reach, and whether that's working through public and private sector or some other means? So if we could hear from every panelist, what are your, and I'm going to keep it short, so top 2 or 3 recommendations for scaling. And then if you could build in, another question asked was about how do you maintain fidelity to an intervention, especially when it's something like a randomized control trial or a specific global curriculum that's been tried and tested, but how do you keep the fidelity when you're cascading trainings, when you're doing training of trainers, and when you're scaling? So at what point do you compromise or do you not compromise? So any reflections or recommendations for that question? And we'll start, let's start with Ingrid, and then we'll move to Vandana, and we'll close with Lucy.
Okay, so thank you, Anna. Well, how this successful initiative could be scaled? I'll start with the case that I presented here, which is, as mentioned, it was not planned. So this is how we saw that the local NGOs, they took the lessons from the community discussions, and we're able to reflect it. In this case, the boys, and reflect it, and then to pay it forward, as I say, in a way that is acceptable and accepted. And so the message from the serial discussions are rolled more forward in that community. So at least in that area, in geographic area, there is some level of scaling up. Of course, I will never expect anything big or grand because of the resources, but at least in a way that it is ingrained in a way in the day-to-day activities in that area. But also for the project itself, Prevention Plus, with the discussions and the campaigns and so forth. We saw that here with our partners, Yabima, they are continuing the work. They are continuing the discussions by their own, despite not receiving any more support, and they are embedding it, for example, in their other projects. So where they are talking about peace building, they are putting GBV issues and material from those sessions, and so what they have learned. They also continue with the advocacy. So we learn how they managed to change, to get a pastor from the church there to finally say that they are against we have a current bill in the parliament that is criminalizing LGBT and so forth, and criminalizing women survivors of violence and so forth. And so we finally saw how they managed to get pastors in their area to state how they are supporting any change to that law. So having a pastor saying I want that law to change is quite exceptional, and that was also not directly part, but that's how scalability happens in a more subtle way. So I hope that, and also the same with the dance in this case. Also, how to make the project as embedded, as ingrained as possible in the daily life is how it can be scaled up. And now with social media, I hope that from the farmers there, it will move on to other farmers in other regions. For the second question on maintaining fidelity of cascade trainings and trainings of trainers. I mean, I think this is, I will never, like I said in my first response, I will never expect them to do everything by the book, but I will expect that the elements from that they manage it to embed it in anything else that they're doing any work. So for example, now they are doing work on peace building, they are putting material from those training in. So it's not that that education, that 2 years or 5 years did leave some residue, and the residue is continuing on. I hope that answers. Thank you.
Thank you. Over to you, Vandana.
Great, thanks so much. I think this is a really important topic and important questions. I think for Unite for a Better Life, we piloted it just in 2 villages to begin with. And then for the trial, implemented the program, in a fairly large geographic scope in 4 districts, almost 7,000 households. So in some ways that was sort of taking it to scale compared to our initial pilot. And, we struggle with some of the same questions, sort of how to maintain the quality of the programming when we're working in so many communities. We had over 50 facilitators, and we specifically chose facilitators from the areas, many of whom, had limited sort of educational background and things like that. What we found really helpful for maintaining quality was having the facilitators first participate in the program as regular participants. And so that means they went through the program over 7 weeks, and that allowed them to challenge their own gender inequitable attitudes and norms, their own ideas about gender equality and about relationships. And then following that, they undertook the specialized facilitator training. So that's one thing we can think about in terms of scaling. But of course, something like that's very resource intensive. So I think one of the challenges with scaling up is sort of, how can you put in all these measures when you're talking about, say, an entire region or entire country? And so I think I don't have sort of the answer to how to do that well, but I think there are a lot of trade-offs. And when you have a program like UBL that was tested in an RCT, I think we have to if we want to achieve that same level of impact, we have to keep in mind not changing too much about the original model, or we risk losing that potential effectiveness. So I'll pause there to make sure Lucy has some time to answer as well.
Thank you, Vandana. Lucy, over to you.
Merci beaucoup pour la mise à échelle de l'approche. Je dois aussi dire que nous, on a commencé, on était focalisé surtout dans la province d'Ongozi, et peut-être que j'ai déjà anticipé sur certaines réponses. Donc, au niveau de la province, j'ai déjà anticipé dans mon intervention précédente, comme j'ai déjà dit que on a formé un petit groupe, 425, c'est trop peu, mais après, je pense que après avoir arrêté le projet, on a fait des descentes sur terrain juste pour voir si ce qu'on avait enseigné sur toutes les formations données aux hommes était vraiment enraciné et était en train de produire des effets. Donc, je dirais que au niveau communautaire, pour nous, le fait qu'on ait trouvé que les hommes qu'on avait formés continuaient à relayer les messages à travers leurs associations, juste de manière sommaire en utilisant les petits outils, sans attendre un bailleur quelconque, ni d'Obravi, ni quelqu'un d'autre. C'était vraiment un bon indice d'une mise à échelle ou bien d'une multiplication des effets de l'approche MAP au niveau de la province d'Ongozi. Et puis, je dirais aussi que le ministère des droits de l'homme et de la personne humaine et des droits de l'homme et du genre, parce que on encadrait aussi le ministère dans le cadre des groupes thématiques VSPG. Donc l'approche avait été partagée par le ministère. Le ministère avait été intéressé. C'est pour cela que malheureusement on était à la clôture, car le ministère des droits de l'homme était en train d'essayer de tester deux approches. L'approche homme comme partenaire sur les violences sexuelles basées sur le genre et une autre approche SASA, pour pouvoir les mettre à échelle et en faire des approches au niveau national. Peut-être qu'on devrait maintenant nous enquérir et savoir où on en est. Pour nous, c'était une bonne chose. L'approche était déjà en train d'être testée dans une province autre de non-intervention du projet Bravi, la province de Chibitoke. Le ministère faisait déjà le testing de l'approche dans une province de Makamba. Donc, c'était vraiment un bon début de mise à échelle en dehors du projet. Et ça serait intéressant maintenant de savoir comment on continue, le ministère continue à s'approprier l'approche. Alors, pour maintenir la cascade, un autre témoignage que je peux partager, encore une fois, après le projet, donc, nous, on n'a pas travaillé avec des organisations formelles pour cette approche MAP. J'ai dit qu'on a juste travaillé avec des hommes ciblés dans le cadre de leurs associations qui devaient maintenant relayer les changements dans leurs associations respectives. Et je vais donc partager un témoignage, c'est que après le projet Bravi, nous avons eu des témoignages et on a eu des audios comme preuve qu'au cours des célébrations publiques, maintenant dans la province d'Ngozi, les groupes des animateurs, donc les animations, on était surpris que c'était le projet Bravi et les choses, les bienfaits, les changements qui ont été apportés dans les communautés, surtout dans la lutte contre les violences, et qui étaient chantés au cours des événements publics. On nous rapportait des audios. Donc, pour nous, à travers les chansons, c'est une façon pour ceux qui avaient participé au programme ou les gens qui avaient bénéficié de leur message de faire preuve qu'ils s'étaient appropriés de ces messages et qu'ils continuaient à les relayer à leur façon pour qu'ils puissent atteindre un large groupe. Parce que la danse et la chanson au Burundi, c'est une société à tradition orale. Si vous voulez communiquer largement un message à travers la chanson et la danse. C'était un exemple pour nous que là où nous sommes passés, les gens continuaient à relayer les messages du projet. Voilà, je vous remercie. Et autre chose, les hommes qu'on avait formés, donc les hommes des associations, lorsqu'on est passé, juste par curiosité pour voir comment s'ils faisaient vraiment ce qu'ils s'étaient engagés à faire, on a été surpris de trouver un jour sur une colline une réunion qui était en cours. On ne savait pas qu'on allait être là, mais le chef de l'association avait tout bonnement l'outil de communication qu'on lui avait donné et était en train de relayer le message. Et lorsqu'on lui a demandé après son meeting s'il faisait vraiment ça à toutes les occasions, il a déclaré, mais tout ce que vous avez fait, c'est pour notre bienfait. Vous avez changé nos vies positivement et nous devons continuer à aider les autres. C'est un beau témoignage d'une bonne appropriation des bienfaits de l'approche et la personne était heureuse de continuer à les relayer. Merci, ce sont les deux témoignages que je peux partager. Je vous remercie.
Merci, Lucy. Thank you to everyone. And so that will conclude sort of our Q&A. As you know, this session is a part of the Ubuntu Symposium, so I'd like to invite Osvaldo back to close us out and just to thank everyone on this call. We've had such a lively discussion. I'm sure we didn't get to all the questions, so please reach out. I will also put my contact information. If something you asked didn't get answered, I'll make sure that you get an answer. Over to you, Osvaldo.
Thank you, Anna. Thank you, all the presenters. This has been an amazing, very inspiring presentation, demonstrating that really the work that we can do with men and boys can be transformative, can contribute to equality and peace at all levels. Thank you so much. Remember that you can register for these upcoming sessions in the Men Engage Ubuntu Symposium website. And also you can see the agenda there and keep being very active in these meaningful sessions. So thank you again, and I hope we can see you tomorrow or next week.